Hello, students. Welcome to your first remote learning lecture. Hope you're all doing well and staying safe. For this lecture, we will look at theories of leadership and practice, a component of our previous lecture we could not complete. Let's first look at the difference between a leadership role and a management role. A leader is someone who will be able to provide guidance, work towards change, and help work towards a common vision set forth for them. They will provide direction, they will motivate and inspire those in their organization. A management role is a position that will provide order, consistency, help with things like planning, budgeting, staffing, and also work towards accomplishing the vision and goal set forth. We will discuss three theories of leadership and practice. The first one we will look at will be transformational leadership. A transformational leader is someone who will be able to model the way. They will be able to inspire a shared vision. They will challenge different processes and help everyone to act together and encourage each of the members of the organization towards working towards achieving the shared vision. A transformational leader will be able to influence and change the followers' awareness of what is important. They will be able to provide a greater vision and give the opportunity for those in the organization towards working towards achieving the greater vision. They need to be proactive, create an environment that will be intellectually stimulating and help individuals work towards a higher performance, higher standard. So looking at this illustration, what we see is a transformational leader will need several components, including being able to influence members of their organization, to be able to motivate them towards working towards the goal. And also, they will need to have individualized consideration, giving attention to everyone's need in the organization, and eventually intellectually stimulating them so that they will be able to have some growth and have a better performance. So let's look at some examples in public health. One of the examples is going to be the Affordable Care Act. When this was enacted, public health leaders needed to be able to promote the policy changes that were implemented. These were new changes. They needed to be able to implement them, have a shared vision, and help change the healthcare model that existed at that time. And they needed to also be able to help participating organizations, meaning hospitals, clinics that would be affected by the Affordable Care Act. They needed to be able to help them function under the new model that was proposed. Another example is evidence-based action plans. We talked about these a little bit in previous classes, where we talked about how CDC and certain other organizations will come up with certain action plans to help change behavioral patterns. It could be healthy eating patterns, it could be stop smoking patterns, something like that. So if you are bringing about change, if you are bringing about a certain changes, you will need to have a transformational type of leadership position so that you can inspire everybody, get them on board, and work towards that common goal. So the next leadership approach we will look at is the situational approach to leadership. What a situational leader needs to do is to be able to adapt to different situations, and then they will be able to address the developmental level of their followers and help encourage everyone to work towards the vision of the organization. A situational leader is a leader who should have skills to adapt to the readiness, to the current level of skills, to the developmental level of their team members. They also have to be flexible to the assets that are available in the organization and use the assets to best fit the needs of the team and the organization. This is also going to be important when it comes to taking public health agencies through the accreditation process. So, looking at what the situational approach to leadership is a leader should be able to take different roles when it comes to uh, different um, assets, different levels of their team. If a team needs a lot of directive, if they need a lot of behavioral supports, a leader needs to be able to take the directing position, giving a lot of instructions to the team and make sure that they achieve the goals. They can also take a coaching position where they will be a motivator to the team to achieve what needs to be done. They can also take a supporting role as the company develops, as an organization develops, where they will be able to um, give a little bit of directive and play a supporting role. Eventually, when an organization knows what they need to do, they can play a delegating role where it will be low support, low directive, but be someone who can coordinate everything. So some examples in public health, this would be uh, when a local health department is going through the accreditation process. We talked about why they need to do so. This is in order that they will reach the standards of the industry to make sure that they are doing the functions they're supposed to do. Thereby, they will be able to obtain funding at different levels to be able to do the public health services they will offer. Another example is going to be a team that will respond to natural disasters or an outbreak. In this case, uh, this particular team and the situational leadership approach will do is look at all the resources they have. They will be able to need to adapt to the situation. For example, if it's a natural disaster like a hurricane, um, like an earthquake, they will be able to know, okay, what's the situation, what are the resources we have, how can we address the situation with the skills and the resources we have. Even so, in an outbreak, they will need to see what type of outbreak it is, what are the needs um, when it comes to public health, when it comes to the medical needs, and how can we approach this situation. So you need to be able to adapt under the situational approach to leadership. The third and the last approach to leadership we will look at is a servant leader. A servant leader is going to have a servant heart. They will need to listen to the needs of their members, of their team, of those that they serve. They need to show empathy, awareness, and also be able to participate in building community. This is also the leadership model that Jesus modeled when he was walking and teaching uh, on this earth. A servant leadership theory is someone who must be a servant first in order to lead. They will need to look at the emotional needs of their team. They will need to display a compassionate heart. They will need to also provide a standard set of ethics and then work towards achieving the common goal. A servant leadership uses a bottom up approach where we will have the senior leadership uh, will be the base where everything else is built on rather than directing instructions from the top to the bottom. They will first look at the needs of the community that they're serving, needs of the individuals or the team in the company, and they will act accordingly. So it is going to be a bottom up approach to leadership. So, what are some examples when it comes to public health? This will mainly be community level public health organizations. They will look to see what are the needs in their community, how they can involve everybody in the community, and try to address those needs. This is also used when it comes to the needs and assessment evaluation that is done, looking at all the needs in the community, assessing all the assets they have, and then how they can use these assets to help meet the needs of the community. All right, so those are the three uh, leadership, approaches to leadership. And for this section, what I would like for students to do is look at this question. This question says, which of the three approaches to leadership discussed in this section will better help public health leaders nationwide navigate the COVID-19 pandemic we are experiencing right now? So please review the leadership approaches we discussed and then post your response to this question on the discussion board section on Canvas.